My name is Sandro Galea. I have the privilege of serving as Dean of the Boston University School of Public Health. On behalf of our school, welcome to today's Public Health Conversation. These conversations are meant as spaces where we come together to discuss the ideas that shape a healthier world. Through discussion, debate, and generative exchange of ideas, we aim to sharpen approaches to building such a world, guided by our speakers who work towards a deeper understanding of what matters most to the creation of healthy populations. Thank you to the many who helped make this event possible. Thank you in particular to Deborah Bingham for all she has done to support David's legacy. Thank you to the many members of our community who have kept his memory a vital presence in our school. And thank you to the Dean's Office and Communications team, without whose efforts these conversations would not take place. We are here today to discuss the forces that shape health in the Mississippi Delta. This is a particularly special event because it is an event in memory of Professor David Jones. David was a friend, scholar, and teacher, a mentor to many, and he remains a deeply missed member of our community. Before he passed away in 2021, David was a faculty member in our Department of Health Law, Policy, and Management. His work on healthcare access and the political determinants of health contributed much to our understanding of these forces. In his too short time, he made a lasting contribution to the field of health, building a legacy that will long support the creation of a healthier world. So it is a joy today to have the opportunity to remember David, to engage with his vision for health, a vision that's now on us to help realize as we discuss his new book, Ripples of Hope in the Mississippi Delta, Charting the Health Equity Policy Agenda. Before we get going with the main event, it's my privilege to welcome David's mother, Deborah Bingham, Chief Executive Officer for the Institute for Perinatal Quality Improvement, perinatal consultant, and the retired Associate Professor of Healthcare Quality and Safety from the University of Maryland School of Nursing. Dr. Bingham, Deborah.
Thank you. David spent 4 years interviewing residents and local leaders in the Mississippi Delta to learn firsthand the intricate connections between race, place, and health in the region. And based on his research, he wrote the book, Ripples of Hope in the Mississippi Delta, Charting the Health Equity Policy Agenda. I am proud to be David's mother. Next slide. And to have had the privilege of working with co-editors along with two co-editors along with David, who are two of David's colleagues. And that's Dr. Nicole Huberfield and Dr. Sarah Gordon. Together, we finalized David's book that was under peer review at the time of his death. And I'm so grateful to Nicole and Sarah for their support and scholarship, as well as to Dean Galea for his kindness and support, not only when David was alive, but when also since he passed away. Next slide. David wrote his book because, and I quote, "Others have written about the effects of social structures on health, but I do not know of any work that brings together statistics and stories to comprehensively examine how these factors intersect and interact in a single place." David was emphatic that blaming individuals for poor health choices isn't the remedy, and his book describes how a community-led, goal-oriented approach to creating health equity policies is needed, and that everyone benefits when we ensure that all people can pursue a healthy and fulfilling life. Next slide. David's untimely and preventable death due to disinvestment in infrastructure tragically underscores a central message of his book and his life's work. Individuals should not be blamed for the conditions that lead to poor health or preventable deaths. Indeed, even if individuals make optimal choices for health, tragic consequences can occur when social structures and institutions do not provide safe, healthy environments. David cared deeply for others and believed that how much we care for each other is reflected in how safe and nurturing every community is. My desire is that David's death will foster a renewed commitment to create safe and healthy environments for all people. David was a hopeful and a practical person. In his book, he highlights 14 individuals, structures, and/or organizations that are ripples of hope in the Mississippi Delta. He reminds us that small steps, ripples of hope, can save lives and improve health. May each of us create our own ripples of hope. Now turn it back to Dr. Galea.
Thank you, Dr. Bingham, and thank you, Dr. Huberfield and Gordon, who edited the book and made sure that David's vision came to life. I'm now going to turn the event over to Professor Tim Callahan, who's a professor in our Department of Health Law, Policy, and Management, which was David's department, who is going to facilitate today's conversation. Professor Callahan, welcome. Thank you.
Right. Thank you, Dean Galea. I'm truly honored to be here today for this public health conversation. David was one of my mentors and a key reason I joined the field of public health. I appreciate this opportunity to honor David's memory and to moderate this discussion of his book on health equity in the Mississippi Delta. I now have the privilege of introducing today's speakers. First, we will hear from Bizhu Galea, Senior Investigator and Chief of the Epidemiology Branch in the Division of Population Health Research at the Eunice Kennedy Shriver National Institute of Child Health and Human Development. Before joining NICHD, Dr. Galea was a faculty member in the Departments of Epidemiology and Psychiatry at the Harvard T.H. Chan School of Public Health, Harvard Medical School, and Massachusetts General Hospital. At Harvard, he was the founding director of the Mississippi Delta Partnership in Public Health at the Harvard T.H. Chan School of Public Health. The program seeks to advance health and well-being in the Mississippi Delta through community engagement, collaborative research, and leadership development. Then we'll turn to John Green. Dr. Green serves as director of the Multi-State Southern Rural Development Center and professor in the Mississippi State University Department of Agricultural Economics. His interests include regional approaches to development, especially in the southern region and subregions, connections between development and health, and use of data on population change in conjunction with community engagement strategies to inform policy and extension efforts. Third, we'll hear from Jamila Michener. Dr. Michener is an associate professor of government and public policy at Cornell University. In January 2024, she began a new role as the inaugural director of Cornell's new Center for Racial Justice and Equitable Futures. She studies poverty, racism, and public policy with a particular focus on health and housing, and is author of the amazing award-winning book, Fragmented Democracy, Medicaid, Federalism, and Unequal Politics. She is Associate Dean for Public Engagement at the Brooks School of Public Policy, co-director of the Cornell Center for Health Equity, co-director of the Politics of Race, Immigration, Class, and Ethnicity Research Initiative, and board chair of the Cornell Prison Education Program. Then we will turn to Philip Rocco. Dr. Rocco is an associate professor of political science at Marquette University and co-editor of Publius, the Journal of Federalism. His research focuses on federalism, public policy, and the political economy of policy knowledge. Rocco is the co-author of Obamacare Wars, Federalism, State Politics, and the Affordable Care Act, and co-editor of American Political Development and the Trump Presidency. His forthcoming book, Counting Like a State, will be published by the University Press of Kansas in early 2025. Finally, we will hear from Lin C. Wu. Dr. Wu is the director of the minor in Society and Health and associate director for the Center for Population Studies at the University of Mississippi. As a reminder for our audience, following individual presentations, we'll turn to a moderated group discussion. When we have about 20 minutes left in the program, I'll then turn it to audience questions. Please submit questions using Zoom's Q&A function located in the bottom middle of your screen. Dr. Galea, I'll now turn things over to you.
Thank you, Professor Callahan. I'm going to share my screen. All right, good afternoon, everyone. Thank you. It's an honor and a pleasure to be here. There is no other place that I would be here at this time than honoring the legacy of David and his amazing work that he has done. We deeply miss him. In thinking about health equity policy agenda articulated in the book, I thought that I would pick one topic that clearly exemplifies the so many powerful social and structural determinants of health that David discussed in his book. And the one topic that clearly exemplified, in my view, is maternal health disparities, where I had the honor and pleasure to collaborate and work with many people in Mississippi. So I will try to answer the question, how can we better advance health equity in local communities and beyond through better engagement of grassroots organizations, particularly focused on maternal health disparities? To just set the stage, I thought I would just share a brief statistics. This is no surprise to many in the audience that the US maternal mortality rate is the highest compared to any industrialized countries. The US ranks first in many of those outcomes, and particularly the maternal mortalities are disproportionately affecting minoritized population. As this graph clearly shows from between 2018 and 2021, the rates of maternal mortality have largely increased, but as often is the case with many of the health outcomes, and this was something that was clearly discussed in the book, non-Hispanic Blacks carry the disproportionate burden of maternal mortality. There is also a geographical divide. Mississippi ranks first in maternal mortality, with Black mothers dying at the highest rate. And a recent report from the Mississippi Maternal Mortality indicates that Black maternal mortality in Mississippi is 4 times higher than white peers. And this is a statistic that's also shared with other health outcomes, but particularly more prominent in maternal mortality. Often in this space, I sometimes hear that the numbers of maternal days are not that high as compared to other health outcomes. But the reality is maternal days is the tip of the iceberg, because maternal morbidity exists in a continuum. There are near misses, severe maternal morbidity, which are oftentimes much significantly higher in Black mothers compared to others. And this is true in Mississippi, in many of the southern states, but also around the country, but particularly the highest in Mississippi. Let me share one other statistics and outcome that was discussed in the book, which is preterm births. In public health, we care about preterm births because it's the main risk factor for neonatal mortality, but it is also associated with many of the outcomes, short-term neonatal outcomes, as well as long-term physical and mental health outcomes. Over the past decade, despite some fluctuations, the rates of preterm births have largely remained the same or increased a little bit. And this graph, which was discussed in David's book, is something that March of Dimes gives each of the states a grade. And one can see that Mississippi has a grade of F, which is states that have more than 11.5% or higher. So if you look at the states in the South, the rates are quite high, and this is largely driven by African Americans. To bring this point home, let's look at Massachusetts and Mississippi side by side. So we can see that the overall rate in Massachusetts is about 8.9. But the disparity of preterm birth rate among Black women is 27% higher than the rate among other ethnicities. This is much more pronounced in Mississippi. If we go to the core delta, where the focus of David's book is, courtesy of my friends on this panel, John Green and Lin Wu, this data came from the Population Center at Ole Miss. When you look at the core delta states, which are the red parts that we can see here in the graph, they have the highest rates, upwards of 18.6 for preterm births. The same is true for other outcomes, including low birth weight, as one can see from the rates displayed here. It's not all doom and gloom. David talks about ripples of hope, and I wanted to share ripples of hope that I had the good fortune to get to know in the Mississippi Delta. This is Sandy Snell, who heads this initiative right from the start. Through her work, Ms. Snell is addressing maternal health equity by working with community health centers in 2 of the places that are mentioned in the book. One is the Aaron E. Henry Community Health Center in Clarksdale, and the other one is in Mount Bayou at Delta Health Center. By leveraging strategic partnership with community health centers, she's expanding care coordination systems and addressing health conditions that affect pregnant women, particularly those that are affected by preterm births. And I had the pleasure working with Sandy Snell to engage doulas and community health workers through funding we received by W.K. Kellogg Foundation. Another ripple of hope that I would like to mention is this is new work that is led by Jackson State University. I had the pleasure contributing to this work, as well as Dr. Green on the panel. The work is led by Jackson State University and Mississippi State Health Department. What they're trying to do is trying to prevent maternal mortality and morbidity through strengthening home visiting programs by addressing many of the structural determinants of health mentioned in the book, including providing support services, maternal mental health care, social support, and connecting them with services that are much needed during the perinatal period. And what I love about the book is it's less about the negative statistics in Mississippi. It is more about a call for action presented in the most public healthy way. And speaking of Ripples of Hope, I thought I would end my remarks by talking two icons in Mississippi. The two icons are briefly mentioned in the book. The first one is Fannie Lou Hamer, and the second one is Medgar Evers. As I think about Fannie Lou Hamer, many of the issues raised in the book, they clearly exemplify what Fannie Lou Hamer fought for. Fannie Lou Hamer was a sharecropper, civil rights activist, a fighter, despite the so many acts of injustice inflicted upon her, including a reproductive injustice. She was someone who fought for political, social, and economic equality for all African Americans. In 1969, she helped start the Freedom Farms Cooperative, which lent land to African Americans until they had enough money to buy it. Those are the same types of solutions that David advocated in his book. By the same token, Medgar Evers was one of Mississippi's most impassioned activists and visionaries for change. He fought for equality. He fought against brutality. He was the first one who launched an investigation to Emmett Till's lynching. So he was fighting injustice. He was fighting racism. And he's someone who went to the battle during World War II and came back, and he was trying to cast a ballot, but unfortunately, he was turned down. But that didn't stop him from fighting for equality and making enormous strides in addressing many of the issues that David talks about. As I think about Ripples of Hope, I thought that I would mention those individuals, and I look forward to conversations. Thank you.
Thank you, Dr. Gallay. I'm now going to turn it over to Dr. Green.
All right, thank you so much. And I also will be sharing my screen. Okay, thank you so much. And I appreciate being invited to be a part of this panel. And I think it's very fitting to speak after Bazoo, because he teed this up very well for the comments that I wanted to share today. And I will be focusing on some of the kind of community aspects of the work and that's featured in Ripples of Hope, and hopefully put it into a little bit broader context. The first thing that I'll note is that it's really important that David spent time in the Mississippi Delta, as can be clearly seen in the book, the richness of the data that he was able to collect to go along with the important literature, the extant literature, and statistics about health and other issues affecting the Delta, but that he spent time talking with people, spent time in these communities. And in fact, I first was able to meet David when he came to what we call the Delta Regional Forum in Clarksdale, Mississippi. And the forum is an initiative that three of us on this panel, Len and Bazoo and myself, have had the privilege to work with over several years, focusing on community and university engaged research and the value of bringing together people from a wide array of institutions and communities and philanthropic organizations and agencies to work together. And so I think this book represents that, really shows us the value of that kind of engagement. Secondly, I want to emphasize that David's work helps point to the importance of the Delta region of Mississippi as a place to learn, a place to learn from. people in this place to learn from. And although he focused his work in particular on the what we call the Delta region of Mississippi, he also helps us to think about this as a much broader multi-state region. And I want to underscore that point because I think it is so critical for us to think about the Mississippi Delta region as an important place as a whole. The chapters within the book address topical issues that are important to health, the types of health concerns that he brings to bear, and those examples around maternal and child health that Basu just mentioned that fit so well with this discussion. And he also gives attention to what people and organizations are doing, and that is innovative problem solving. And in this case, the Delta is a particularly special place, as was mentioned with the community health centers as a great example. The work that has taken place in the Delta region as being critical, not just for the people and communities of the Delta, but for the nation as a whole. That this type of innovative problem solving and actually doing clearly comes out in the book. And I would argue that if we're answering David's call that he makes in the book for more context-oriented approaches to health, would require that we take the processes of community development seriously. In other words, really emphasizing that these things didn't just happen on their own. They took initiative. So as a field of scholarship and practice, I think that we can say that community development is inherently hopeful, that the intentionality is really the key for how we think about the difference between development as intentional effort versus just more general change that happens to people or feels as if it's just happening. So the examples that David gives us show this, and there are hundreds, literally hundreds of other examples to draw from in the Delta region alone, not only in Mississippi, but back to my previous point, thinking about the larger multi-state region, that there are so many efforts of intentionality that we can learn from. Community development is often discussed in terms of outcomes to be achieved, but if we think about the processes and strategies of community development work, I think there's so much to be gained. We can think about working across traditional boundaries toward common goals. And this effort in and of itself helps improve the sense of community and results in even greater momentum, or to put it back in David's words, the rippling effect. We could focus attention on emphasizing collaboration between organizations, between communities, thinking about collaboration across rural and urban locations and across sectors, whether it's government, businesses, nonprofits, and even the informal sector. But there's a great deal for us to learn. And then finally, I think by attending to the processes of community development for addressing health in the ways that are illustrated within the book, that we can think about the potential of this ripple effect. And I think it's interesting, given the title of David's book, that within community development work, there's a whole methodology for how we think about this in terms of evaluation that's called ripple effect mapping. And so I think there's a great potential conversation of our various fields and disciplines to advance this work. And if we take community development seriously, then we can think about some broader approaches to thinking about policy and the necessary investments to improve health. And so I've had those listed here. First of all, how can we scale up successful community development efforts? As we said, there are so many examples. Thankfully, the idea of the community health center as one of those has been scaled up, I think, to a level of impact across this country and even internationally than what was ever assumed would happen at the kind of onset of those grassroots efforts. Also, how to generate more efforts to advance processes of community development. What are the smart investments that we can make to really help this type of innovation to blossom? And for example, investments in social entrepreneurship. And then finally, to give attention to how to facilitate and build capacity for the kinds of collaboration that I mentioned. And so I think if we learn from those ripples of hope that are displayed in the book, and just use that as an entree for so many other additional efforts that we can study and learn from, that we can really inform community-based solutions that are responsive to health and can help to drive policy. Thank you very much.
Thank you, Dr. Green. A really important presentation. Let's pass it off to Dr. Jamila Mishner.
All right. Hi, everybody. I am going to depart at least from the previous two speakers, and I'm not going to use slides. I'm always on the fence about slides, and the upside to slides is that there's something that people have to look at besides your face. But the downside is, at least for me, they can sometimes be distracting. And so I thought, especially given my own familiarity with the book and with the author of the book, with David Jones, and with so many of the topics that are tackled in the book, that the best approach today would really be to take a few minutes to speak to you, certainly from my head, which I always do as a researcher and scholar, but also from my heart. And I thought it would be easier to do that if I didn't use slides. So I gather that many of you are here today for a wide range of different reasons, but at base, I would presume that a lot of people who are in this Zoom room care about learning. You come to something like this because you're interested in learning more. And in particular, you're interested in learning more about the kinds of topics that are that are addressed in this book, in Ripples of Hope. Maybe some of you are in the room who are also teachers, your faculty members, or you teach in other capacities in your day-to-day life as you do work in communities, as you interact with people, as you try to intervene in the world around issues of primary importance like those that are the subject matter of Ripples of Hope. And one of the things that really stands out to me about David Jones is both that he had, I think, an incredible ability to learn and to teach. And I want to focus on that in the next few minutes as I make these comments about Ripples of Hope. I want to focus on some of the things that both through the book and through my observations of David Jones in life, the things that I believe and have seen him learn. I think it's really important for us to learn from others as they're learning, from their growth and development trajectories, for us to benefit and learn from that. And I also want to emphasize some of the things that we're taught through the book, directly through the book. So really thinking about both learning and teaching. And on the learning front, I'll say that when I first met David, it was at the University of Michigan. I was doing a postdoctoral fellowship there, a health policy postdoctoral fellowship with the Robert Wood Johnson Foundation. And David was still a graduate student. And I brought David on to work with me on a project in part because he had a reputation for being a kind of like policy wonk expert. You know, if there's something that you want to know about the Affordable Care Act or a similarly wonkish policy topic, David was a good person to start with, right? And I point this out to say that one of the things that really strikes me about Ripples of Hope is the distance that it's clear from reading that book that its author traveled intellectually. So when I first met David, he was not someone who I thought of as doing work that was deeply integrated in specific places and rooted in a place-based understanding of complex root causes of health inequalities, right? But that is, in fact, the primary orientation of Ripples of Hope. And it's hopeful for me to see that where David started is not where he stayed. that the book itself represents a trajectory of growth and learning. This is a complex, difficult, only everyday more challenging world. And without an orientation towards learning and growing in our way of thinking about and understanding that world, I think we will be far worse off. So to see, there's lots of policy in the book. It's not that David stopped being a policy wonk or stopped caring about the details or the nuances of politics and policy, but that something else got integrated into that, additional perspectives, additional learnings. And one of them is about the importance of place and about developing a place-based understanding of what explains some of the health disparities that are part and parcel of our country, and in particular, part and parcel of life in certain places in especially acute ways, places like the Mississippi Delta region. The other thing that it's really clear that David learned is about the importance of social and structural determinants. So when I first met David, he was very much a kind of healthcare, health system kind of person. And I can't remember actually having many conversations in those days about education or jobs or neighborhoods or food. The conversations were mostly about access to health insurance and healthcare systems. And of course, access to health insurance and healthcare systems, that's so important. But one of the things we learn from the book is that there's a much wider and deeper web of factors that are structuring people's access to health. And so to see that emphasis, that scope, that capacious scope in the book, and to know that that represented growth for David in his thinking and in his development as a scholar is, again, really inspiring to see that that reflected in the learnings that are embedded in the book. The other thing that I'm really struck by is the ways that David clearly learned the importance of a deeply humane perspective. And I think that anybody who starts to engage communities and be present within them and really listen to the people who are undergoing the experiences that we care to understand more deeply can come to have a more, I think, fundamentally humane perspective, but not everybody does, right? I think everyone can. I think that many of us have the opportunity to in the right circumstances, but not everybody does. And when I say a humane perspective, what I really want to emphasize is the way that David brings humanity to ripples of hope, first of all, is by centering it in people and their communities, their perspectives, and second of all, by not only focusing on the deficits in those communities or those individuals, but being attentive to their strengths and assets. And not in a hand-waving kind of way, right? But in a real substantive way that not only emphasizes hope, but emphasizes agency, possibility, and the ability of the people who are being affected most acutely and harmed by so many of the systems that we do, often as social scientists, a really good job of cataloging, but to really go beyond cataloging and to not just think about the problems, but to start to grapple with the possibilities and the solutions requires a level of humanity that we bring to understanding the people and the subjects that we study. And that's clearly something that David learned along the way. And what I admire about that is that it's not something that one can take for granted. It's not something that everyone learns. I don't think it's, in fact, the norm, even in public health fields, and certainly not in political science and in other disciplines. I'm going to wrap up in just a few minutes here. I want to point out just one or two things in addition to the things that David shared with us that he learned. I think there are some critical things that he teaches us in the book, many of which have already been raised by the panelists here today, and I'm sure will be raised by the folks to follow. I want to point out just a few of them that I think are especially critical and that I want you all for sure to take with you and hopefully to take into the world in really important ways. One that I think is so important is to get beyond the inclination to think about health as a function of individual choices, right? And in fact, the book says that it's a false dichotomy to view health as a function of individual choices or of contextual factors, right? But instead that both of these things are at play. And David points out that people are more likely to be healthy if they eat well, if they maintain an active lifestyle and they have access to high quality health care. But those aren't just choices, right? It's harder to make the choice to eat well or to be active or to see a physician when you need to, if you don't have access to economic, social, and other kinds of supports. And so that emphasis and insistence on not blaming people for the failings of our structures is a really important lesson. The other thing that comes out in the book, I think is really important, and I actually pulled this line out because when I read the book, it stood out to me as vital. There's one line in the book that says, "The problem is racism, not race." And again, this is taking what can be understood to be a demographic trait and instead highlighting as a process that over which we have some agency, a process that isn't just inevitable, that certain kinds of people will always be at the bottom, but is based on a series of political choices that can be changed, right? And that way of understanding and thinking about racism and thinking about injustice is really important. And David is able to eliminate that or illuminate that in Ripples of Hope in ways that aren't alienating or accusatory or negative, unduly at least, but in ways that feel productive and generative and important. And the last thing I'll say that I think is really vital is that I think this book teaches us to hold two things that can feel conflicting at the same time. And one of those things is a real cognizance of and acknowledgement of the deep and abiding problems with our systems and structures that produce and reproduce in very consistent and painful ways inequities of the kind that we see in the Mississippi Delta and well beyond that. That is a reality that we have to hold. This book does not allow us to run from it. But at the same time, Ripples of Hope allows us to hold alongside that harsh reality a sense of hope and optimism about what people can do and how they might be able to do it, right? And there's actually a line in the book that says, optimism is empty unless we name injustices that need fixing and are specific about their root causes. And so this holding of optimism, but also having a high bar for the substance of that optimism, not accepting an empty optimism, but demanding an optimism that comes with hope because it has acknowledged the injustices that need to be corrected. That is a fine needle to thread. And this book threads it beautifully and allows you to learn a lot that's hard about the world and about the Delta, but still not walk away feeling defeated. And I'll end my comments there. Thank you.
Thank you, Dr. Michener. I'll now pass it off to Dr. Rocco.
Great, thank you, Tim. Always hard to go after my colleague, Dr. Michener. Such valuable insights there. And it's a real honor to be here to talk about the incredible work of David Jones. I want to talk particularly today about this book, as a piece of literature, because I think it's really beautiful. And I also want to talk about it as a innovation in social science. And to talk about this, I want to tell a story. When I first talked to Dave about this project, the project that would become Ripples of Hope, I had a sense that it was going to be something extraordinary, something special, something that we would be having lots of conversations about in the future. I think David and I were in the lobby of some frigid hotel waiting for a panel at a conference to start. And I just said something like, what have you been up to recently? What are you working on? And his eyes just lit up in the way that you might remember that they often would when talking about conversations with local leaders, with ordinary people, and about how those conversations and sort of being in the Delta had crystallized his thinking about the political determinants of health. And in talking to David at that moment, I sort of remembered something that the sociologist Max Weber said, that ideas come when we don't expect them, and not when we're brooding and searching at our desks. And I think that if you read this book, you're going to see that it provides a huge proof of that statement, that real ideas emerge when we're enmeshed, when we're sort of passionately involved in the world that we're studying, not removed from it. And that spirit, that kind of passionate encountering of the world, is, I think, what makes social science or political science vital. And you can see it on every page of this book. The former president of the American Political Science Association, Jane Mansbridge, I think in her sort of presidential address for APSA, mentioned that if political science is for anything, it is and should be for helping us govern ourselves. And that's because it's the one academic discipline that is explicitly organized to study how we make collective decisions on matters of great importance, including but not limited to improving the conditions, the material conditions that affect health outcomes. And so as I see it, I think that this book provides a huge set of lessons for how social scientists might think about their work and restructuring their work in ways that serve the common good. So these comments are sort of for the academics in the room to think about, like, what is it that we are doing? Because David's book has a lot of important things to teach us about that. So the first thing is, I think that this book realizes the power of something that might seem very simple, but it's very important, which is combining the synthesis of research with the analysis of new data. So one of the great suppositions that David makes in this book is that there's actually already a great deal of knowledge out there about how social, economic, and political conditions shape health inequality. But rather than using this sort of body of prior knowledge as a Bayesian statistician might, to just inform a set of prior probabilities, David uses this knowledge to inform, to enrich, to contextualize the findings from his deep qualitative and ethnographic work in the Delta. As a result of that synthesis, it's easier to trace the link between patterns of behavior and health outcomes as a configuration, right? That's one of the big values of what David's doing with that ethnographic work in the data, is that we begin to see that health is the result of a configuration of variables and not something that can be reduced through the sort of innovation of statistics to just sort of individual data points. And I think that's a necessary complement to a literature that rarely takes stock of itself, that really needs to be interpreted in light of particular social and economic conditions. And so what David does is bring together this mass of research on the root causes of health inequality. Again, research that's already been done, but then leveraging it to help us make sense of the conditions he observes in Mississippi. A second move I think that David makes in this book, and something I think we can learn a great deal from, is that he emphasizes the value of kind of translational policy research. Throughout the book, again and again, David returns to ask how his research findings from the Delta, as well as his synthesis of research, cashes out in policy terms. In other words, one of the most frustrating features of reading a lot of books about public policy is, I call it the last chapter problem. So, you get several chapters of kind of magisterial analysis, really in-depth analysis of a policy problem. And then the last chapter of the book evolves a set of policy recommendations that can frankly feel rushed, perfunctory, something less than the sum of their parts. And I say that from personal experience. The last chapter when you're writing a book is the likeliest to be rushed. David, as a literary matter, I think it's worth highlighting, he short circuits that problem entirely by spelling out pretty clearly, pretty explicitly, the policy implications of each of his findings in each chapter as you go along. Not only in sort of vague general terms, as many social scientists often do, sometimes myself included, but with specific reference to policy interventions that individually and collectively, there's evidence to show have been able to make a dent on the policy problems that he identifies in each chapter. So in other words, the ripples of hope come not from merely what he observes, but his ability to say, look, this is not in many ways a knowledge problem. We know what we would have to do to deal with this. So we don't need to outsource that part of the work to lobbyists, to policy professionals, to activists and others. But if you have a really good sense as a social scientist of what your findings mean, you should be able to trace what policymakers and people with authority should be able to do about the problem, at least provisionally. The clarity of the policy implications in this book reveals, I think, and to put a slightly different gloss on what Dr. Michener said before, I think David has a pessimism of the intellect, but an optimism of the will. There's a sense that pervades the book that human beings can and do take action to solve the problems that he lays out. Their actions might be incremental, they might be marginal at first, they might be highly localized, but they're evidence of collective action, and that demands our attention because that's the only way we're actually going to solve the problems in a larger sense. So the ripples of hope, it's not just a literary technique in the book's title, they're not notional, they're actually there in the book. And I think that's a nice antidote to, frankly, I think a trend in social science, I would call it sort of a fin de sec characteristic of social science, that over the last 20 years or so, in which I think social scientists often present problems and contradictions in the contemporary political economy as things that are essentially insoluble. And I think that David rejects that premise full stop. And that is what makes the book generative. And I think that that also sets up a potential for a new kind of dialectical relationship between social scientists and people in the policy community and everyday people who live with health inequalities. The one in which social scientists do not really regard people in the world that they study as subjects of a study or as a downstream audience for the study, but as partners in what they are doing that can refine the research, as Proverbs 27 kind of reminds us. Iron sharpens iron. Although I think the most significant intellectual move, and one that I keep returning to again and again when I pick up this book, and one that has probably reshaped the way that I think more than anything else, is the choice to focus on the region as a unit of study. I think it's no secret, if you live in the United States, that place matters. We know that the health inequality gradient varies vastly across the more than 3,000 county or county equivalent governments in the United States. But place features in health policy literature often merely as a unit of analysis or a container for other variables like poverty, race, environmental hazards. As a result, I think we are left typically with very little to say about why place matters, if it does at all, what place is doing in the analysis. And I think that that contrasts with the experience I certainly have of living in a place where there are high concentrated indices of disease, lower levels of life expectancy. A place works. It is a process, not just a container for a series of other variables. So by studying a place in full, through immersing oneself in it, it becomes far easier to see how a conjunction of variables which interact with one another, often over long swaths of time, impose these outcomes on local residents. So in this book, Dave rejects, I think, fully the idea that place is just a unit of analysis or a container. Instead, the region of the Delta figures as a distinctive spatial context that brings together a configuration of variables that make for drastic health inequalities and make the region among the unhealthiest in the country. David's very careful about how he defines the region, which makes it possible for him to really concentrate on the political economy of the Delta, as opposed to, as I think a more sort of off-the-shelf study might do, a unit of convenience, like the county or the county equivalent, or the state. As a result, I think we're able to see how both structural factors and the choices of agents with authority can co-produce health inequalities in a way that kind of isolates, that goes beyond sort of isolating things like state capacity or revenue as a variable detached from other variables simply could not do. And by doing that, I think what we can see is that what matters is not just sort of variations in the prices people are charged for services or the availability of particular providers, but variations in the quality and depth of democratic institutions, participation, and the sort of deep legacies of apartheid. This is a necessary counterweight to the idea that there's sort of one or two variables that if you tweaked, you could simply reorient the health of a region or of a population. I think it forces us to think about the changes that need to happen to address health inequalities a lot more holistically than we currently do. And there are any numbers of examples of this, but I would say, I think it's forced me to think more about the kind of region level interventions like the Delta Regional Authority as something that may or may not have some effect on health inequality. And so I think it kind of forces us to think about what are we doing at the level of the region to deal with these problems, and is it enough? In other words, I think we need to think much more broadly and more synthetically about what we might do to support health in regions, or what a complex of federal programs would look like that could unleash a series of positive feedback effects that would result in measurable improvements in health outcomes. On that point, I think David's book also raises another question. Anything significant policy-wise is going to be done in the Delta is going to require federal support, but it's also going to require a high level of political activation and mobilization at the local level. And it raises the question of how do you unleash that kind of process of activation? The beauty of the book is that David doesn't necessarily provide us with all the answers, but because of the clarity of its prose, because of its approach to the analysis, it powerfully guides us to what I think the right questions are, what we should be asking, and allows us to think about how we could, by solving even small pieces of the challenge, turn the ripples of hope that we see in the book into something more like a tide. So that is really the gift, I think, that David's given us in the book. And I think it's a gift that's going to inspire future generations of scholars, of policymakers, and activists, and really anybody who thinks a better world is possible. Thanks.
All right, thank you, Dr. Rocco. I will now pass it off to Dr. Wu.
Good afternoon, everybody. There's really not much more I can say that hasn't already been said about David's book. As the Associate Director of the Center for Population Studies, as part of my job is to focus on our state of Mississippi, and also as a native-born Mississippi Deltan, I always love when people come down and want to be part of our community. David very much became part of the Mississippi Delta community, and I know this when talking to other people I know throughout the area, and they're like, "Oh yeah, I remember David. I remember talking to him about this and that," and so on and so forth. And so, as a social scientist, as a community development person, community engagement person, I am very much appreciative of how much David invested of himself in the area. And I think that goes both ways. The best research, I feel, has always been somebody who can invest in the area because they'll invest in you. And I think David understood that. And as an academic, sometimes that's hard because we're so pushed by certain timelines. But David was very good at really pushing that, of investing himself in it. And he always made sure to do that. Something that I think hasn't been spoken about by other panelists yet, but maybe was very apropos for me today was the last day. This is the last week of classes for our university until finals week. And today was the last class I taught my medical humanities course, and talking to students. And I was thinking about this book and just how hopeful this book is. David did a great job of being very critical about issues, yet without disintegrating all hope. And I think it was in his conclusion that he addressed this issue of not wanting to sound like a Debbie Downer, not wanting to be a grump about things, but how to be critical about a lot of sensitive topics and issues in an area, while also still instilling that little bit of like, but this can be changed. There's always a way of integrating this. And I think this book is a great example for students to start off with, like, I assigned a lot of different readings this semester, and a lot of it was quite depressing, but we try to talk through it. But I think he was very purposeful in instilling that ripple of hope, and that here's some issues, but these can be overcome, right? We can overcome a lot of this. And I think for students, I think about our future, medical professionals, our future political, people, our researchers, sometimes that needs to be, our students need that. And I think this book would serve as a great example of how to do that kind of work, of how to instill yourself in a community, how to do the research, be critical, but yet insert a lot of that hope that things can change, that we need to invest, and that we can do this work, and that things will become better, and which includes those small wins, right? It takes a lot of small steps. Things will not happen overnight, and that's the investment portion of it. On a personal note, having known David through like John and Bizu, with the community, with the Delta Regional Forum, David was a great listener, I think, and that was wonderful as a social scientist and as a community development person. Being a great listener is what we all want. And he was so invested in Mississippi and so invested in the Delta, and we greatly appreciated that. In this book, I think I can't wait until I can share this with our students. I have there's so many things that I can see happening. Again, like I said, most of the readings that we have tends to be very depressing, very sad, and kind of harps on a lot of the same issues. But his writing in this book was such a great way of instilling that little bit of glimmer of but there are ways of changing this. So I think I don't want to hold on too much longer, but I think I'll pass this back on to Dr. Callahan.
Okay, thank you so much, Dr. Wu, and thank you to all of our speakers for their presentations. We're now going to move on to our moderated discussion with all of our speakers. As a reminder, we will turn to audience questions when there's about 20 minutes left in the program. And please be sure to submit your questions using Zoom's Q&A function at the bottom of the screen. I'll ask all of our panelists to turn their cameras and their audio back on so we can start the moderated discussion. And as we start that moderated discussion, I wanted to focus on those structural barriers that so many of you have talked about. Ripples of Hope points to these structural barriers that make it harder for people in the Delta to live healthy lives. And knowing David and thinking about his legacy, what he really cared about is helping people and making change happen. So how can we use this book to push forward meaningful policy change to help people who are living in the Delta? I'd love to hear from all of you, but maybe we'll start with Dr. Green. How can we make change happen in the Delta using this book?
Yeah, thanks for that question. And I think just a few points come to mind. First of all, the importance of appreciating the complexity and nuance of place-specific issues. And I think that this book raises those. I think David does a great job kind of helping us to understand those and provide some ways for thinking about that. And then secondly, recognizing that, as was pointed out earlier, that policy beyond health or health-specific health access is important, right, for all of these different social factors that we know matter for health. And then also, I think giving attention to what I often refer to as small small p policy, if you will, right? We think about these big kind of federal level programs and investments that we know are so important, but there's a lot of other ways that policy is developed and plays out, including at the local and state level, and so there are kind of other avenues besides what we just read about and hear about as important policy issues. And then the final point I'll make is just the need for more rural focused policy discussions, to understand that places are different, and we need to understand, first of all, what's the diversity in rural places of experiences and challenges and assets, and really respond to what's unique about rural places.
Wonderful, thank you. Dr. Gallay or Dr. Wu, I know you both also work quite a bit in the Delta. Do other things come to mind for you?
I think part of, like I said, what I was saying before is I think students, our future policy decision makers, our future policymakers, engaging with them in this way of combining, using mixed methods of combining health statistics, data, along with those more pointed regional, interviews and the local, the local environment of what's happening. Them understanding culturally what the area is and how it is, and then mixing that with that data and being able to critically, analyze that. I think having, equipping our students, our future leaders, and giving them those skill sets to do that type of analysis and critical thinking skills is super important.
Yeah, I think, if I may add, I think, David highlighted the core tenet of public health at the outset, which is relevant for Mississippi, but also other places, which is often lost in the discussion of individual choice for freedom. While individual choices are important, health outcomes are dependent on sets of relationships and structures and systems that we have in place. And then I think, that is true for many of the places. And there's a brilliant author, Imani Perry, who says that the South is the soul of the nation. And Mississippi is the best example for addressing many of issues that we know are relevant in the country. So it is true that many of the topics that are raised would help shape meaningful policies for Mississippi, but they could also be relevant to other places, because this could be the best example for understanding many of the structural determinants of health when he's able to juxtapose Milton and Mattapan neighborhoods. What we learn in Mississippi Delta could be relevant for the issues that we would notice in places like Boston. One could make similar comparisons, even if they are in different geographic locations.
Thank you, Dr. Gallay. I think that's a really important point, and I'd love to build on that, right? So Ripples of Hope is first and foremost a book about experiences of individuals living in the Mississippi Delta, but we're here today talking to a national audience, a global audience. So maybe I can turn this over to Phil or Jamila. What do we think about the lessons this book provides for individuals across the country, not just those living in the Delta?
I would say the first thing, and perhaps most important feature of the book, is by identifying ripples of hope, by which David means people who are already on the ground, situated in context of deep health inequality, know what the sort of proximal cause of that is, and have the potential to build political power. They might not have political power, but that's actually where you would begin to build it. That is a feature of communities that experience, I think, deep health inequality across the country, is that kind of sort of disarticulation from structures of power. And I think what this book begins to do is to say, what if we began to map where those sites of potential are? And what if we began to kind of consider what was possible through creating a collective power across those sites. I mean, I think that's where the kind of promise embedded in the book is. I mean, somebody should develop a teacher's guide to Ripples of Hope, because that's actually something that, you know, it might not even be there sort of fully dressed within the four walls of the page, but it's there throughout the book. And so, yeah, I would leave that as somebody should, in fact, develop the teacher's guide to this, because I think it would be useful.
Yeah, I will just jump in. No good deed goes unpunished, Phil. So
Yes.
whenever a sentence starts with somebody should, I would expect to be asked to be the somebody rather than later. No, I agree with that. And I guess I would reinforce what Phil just said and, you know, highlight the fact that, you know, I've observed in teaching a course that I teach on campus here at Cornell on health equity that attracts a fair number of students who are in the kind of public health space who want to get their MPH or what have you, that they come to the course really thinking about public health and health separate from politics and power, and kind of intentionally wanting those two to remain separate and thinking I'm interested in the public health piece of this, right? And if anything, in the last several years, I've seen students lamenting public health or health being politicized, right? Like, oh, look, this non-political thing, and it's being politicized. And some of that is legitimate because we've politicized in unhealthy and I think harmful ways public health institutions and actors over the last several years. But also embedded in there is a misunderstanding of the causes of health inequities and the nature of the processes that determine access to health and healthcare, but health more broadly, including all of the social determinants that entails. And that underlying assumption that health disparities, public health, those things aren't political. I think that assumption gets put to rest in this book in a way that's really valuable. But it doesn't do it by showing us all the ways that like folks in the White House or in Congress or in our state legislature are sowing the seeds for health inequities, although they are, right? But that's not the emphasis. The emphasis is instead what's happening in people's lives in communities, connecting that like very, you know, micro level experiential set of factors to like broader macro and meso level policies and politics, helping us to see the integration between those and helping us to understand that the path to change requires activating, mobilizing, organizing communities around advocacy and other activities that are going to allow them to push back against the kind of political barriers to health. So I think some of that is like out there already, but the way that David brings it together and the way that it becomes impossible to recognize the kind of political and power elements embedded in the public health sphere, I think is a really major contribution.
Thank you so much for that. And that actually leads into my next point. David was a scholar who focused on the politics of healthcare, just like both you, Jamila, as well as Phil. And I want to dive into something he focuses on in the conclusion of his books, which is pointing to the fact that voting rights could be a key mechanism for overcoming these structural barriers to good health. We're in a new political moment, it seems like, at this point. How can we improve political participation, first and foremost, in the Mississippi Delta? And then how can we improve voting rights to confront our current political moment? Does anyone have any thoughts on that? Or thoughts on the political elements of the book more broadly?
I'll weigh in there just to emphasize that I think given the great examples that David provides of people doing work on the ground that I mentioned and others mentioned, is that it's more than voting in terms of participating in governance. And so being engaged at the local and state level, being engaged with nonprofit organizations and associations and so forth. I think really just expanding what we think of as taking advantage and applying political rights, voting being one of those, but just thinking more expansively. And I think part of that also entails, us doing a better job at civic education about how these things work. Like how is school funding determined? How do we go from local organizing to develop a community health center to actually funding one? That there's a lot of processes that we need to help people to understand better. And then I think also in that, it makes voting seem much more worthwhile than just who they're voting for, but being engaged with the entire governance process.
Yeah, I just want to quickly say, I think that's so important because it is easy to look at certain states, and a state like Mississippi, for example, and say, oh, well, I mean, does it really matter if you vote there, if you're voting in a way that doesn't seem like it's the kind of prevailing, or dominant successful party or what have you. And in general, it's easy to get, I think, a little bit alienated from politics, given the kind of depth and extent of partisan polarization, and given some of the toxicities in our political culture at the moment. And so the temptation, I think, for many people is right now in this moment is actually to turn away from electoral politics. And while I don't think that's a temptation that we should give into, I also think one of the things that helps is to widen the aperture beyond elections and electoral politics, and to think of that as one tool in a broader toolkit. And the other tools are really in community and in places that people may not have the same degrees of alienation from as they do from formal political processes. So I think that more expansive approach is exactly the way to go.
I mean, I would be remiss if I didn't sort of add labor market institutions to the mix. I mean, Mississippi is a state whose economy relies on a vast low-wage sector, and a sector where union density is, among the lowest in the country, and has been, historically for quite, some time since the sort of advent of the labor movement in the United States, but where there is actually potential through alt labor and other forms of organizing to begin to create countervailing power, because power can exist at the ballot box, but I think it actually requires kind of intervention at the situs of work, where as we know, so many health risks emerge, and where the sort of health risks that are induced by low wages perpetuate. So I mean, I think that's you can't look at health inequality in Mississippi or anywhere else in the United States and not talk about the fact that workers lack important control over the conditions of their labor.
Yeah, well, thank you for this wonderful discussion. I have a million more questions I could ask all of you, but I did want to make sure we save some time for audience questions as well. So as members of the audience, if you have additional questions, please use that Q&A function at the bottom of your screen. But several questions have come in already, and I'd like to get started on those. So one question that's come in over the course of our presentations here today focuses on this idea of community development, but also the idea that a lot of the change we might like to see requires funding, but community development and things like that don't get the best funding. So how do we pursue some of these changes that David suggests and that Ripples of Hope points towards in the light of the difficulties of funding things like community development?
I'll just chime in quickly and say, I think two things. One is that we want to try to expand the opportunities for funding, and some of that means not taking for granted the current funding configurations, but instead pushing funders challenging funders, asking them why they're funding certain things and not funding other things. I think those of us who are academics often have opportunities to engage funders, and in those contexts, we're often thinking about how we can get resources from those funders. But one of the things I've been trying to do recently is when I have an opportunity to engage, in particular philanthropic funders, to really push them on like why they're happy to give me a multi-million-dollar grant, but like aren't funding community organizations. Like, what is that? How do you make sense of that? What is the theory of change underlying that? So really like pushing on that front to try to shift the realities in the funding landscape. And also for us as researchers, looking for opportunities to embed community-based organizations into the work that we are able to get funded, and not in kind of secondary or derivative ways, but in ways that allow us to truly co-produce research with them and that help to support them. I think that's really important. And the other thing I would say is being on the lookout for changing funding landscapes and opportunities. I know for sure there are funders right now who are feeling like, we're not sure how much positive change is going to come at the national level right now. So like maybe we'll fund some community things that we hadn't been attuned to before. I think that the funding landscape is always changing. And so being an active part of the change and also being ready to take advantage of opportunities when they emerge, being nimble, is really important.
I think if I may add to that, there are the two examples that I shared are examples of funding that came from local foundation as well as from NIH. I mean, that's true that funding is challenging for community engaged work, but there has been some changes in some cases where there is a requirement for engaging community partners. So I think there are some creative ways of engaging, and there's definitely some change, not to the extent that we expect. Other funding agencies outside the US, like the Wellcome Trust, for example, they make it a requirement that one needs to engage community partners in doing their work. But we still have a long way to go from the US funding model. But there are foundations, particularly locally based foundations, that support those types of activities. So I think it's a matter of persistence and continuing to find creative ways of addressing the issues.
Yeah, I would underscore those points that have already been made and just add to that in terms of the kind of more moderate to long term, that we also need to engage in more kind of applied scholarship to inform policy development about what types of community development initiatives and processes, as I mentioned earlier, result in better outcomes, and to help, how do we translate that into the types of investments that we want to see, whether it's through government, whether it's through philanthropy, and do a better case of helping to understand the effects of this work, and then informing how we can fund it better.
Thank you so much. Another question that's come in, and I think it's an interesting one in the context of this book. This book is called Ripples of Hope. And the whole point of this book is to point to examples of hope as we try to deal with some of the structural barriers to health in the Mississippi Delta. And the question that came in is, I'd love to know how folks are managing their own sense of hope for addressing entrenched inequities, given the incoming administration and changing political circumstances. So in your own world, how are you managing your own sense of hope for addressing inequities that exist in our health landscape? It's a tough question, but I think a really interesting.
I will just say one thing that I have found really vital is to be quite disciplined in what I give my attention to and how much of it I give my attention. And so just, for example, limiting my social media intake. Now, I'm not the sort of person who's going to completely cut it all off, because I am teaching students and I'm doing research and I need to know what's going on in the world and how things are being talked about, and I need to be engaged. But I have a much more limited social media diet. And in general, a limited news diet. I mean, I will read the news rather than watch it, because I realize watching it gets me more emotional and emotionally invested. Just strategies like that for maintaining one's own emotional balance and well-being, whether through distance from certain things or through just limiting. And then what am I actively giving my attention to? So I have been really over the last several years investing more in work that's happening in the communities where I live, and in work that is oriented towards positive change in the world, and seeing some of those wins, even if some of them are local or they're small, but seeing how they build and they grow, and strategizing about how to grow them further, and really focusing my energy on the good that many people are interested in doing in the world, and on what I can contribute to that good, I think has been very important. And then last thing I'll say is just finding the things that I know give me joy, and giving myself like the leeway to really lean into them. You know, Audre Lorde talks about rest as a form of resistance, right? And I think that we sometimes think that if we want to change or resist status quo conditions, that we have to be fighting all the time. And there is fighting that's necessary, but knowing when to step back from the fight is also important. And that's been a lesson that I've been learning more and more these last several years, and that I think we'll need in the ones to come.
Wonderful. Thanks so much. I want to take this chance to focus on this book as a teaching tool. It's something that's been mentioned once or twice already, but I really wanted to spend a minute on this for a few reasons. The first is, here at Boston University, it's never lost on us that David was a much beloved instructor here, that he was dedicated to teaching. He loved his students, and the students loved taking classes with him. And as I read this book, I was struck that this book could serve as a wonderful teaching tool. And there's many potential students on this Zoom right now, and there's also a lot of instructors as well. So as you think through the book in the context in which you read it, how might this be used as a teaching tool? Maybe we can start with Dr. Wu. I know this is something you mentioned a bit already as well.
Yeah, I think he did a great, like I said, as a mixed methodologist, he did a great analysis of bringing together both the quantitative and the qualitative, and teaching that skill set of especially looking at very regional areas and specific areas. I think a lot of our students, especially those in Mississippi, bringing that together and, highlighting those ripples of hope for them, because I think for so long, many of our students in Mississippi they're still kind of entrenched in the national narrative of their state. And only by doing what David did, by really doing a deep dive in specific communities, he was able to find these ripples of hope for them. And I think reminding students that, we're not our national narrative, but that we should be looking at areas that we can improve, what is working in those areas, and how to highlight that, how to expand that, and to pass that along, and to always use those skill sets that they're learning, hopefully in our classes, and maybe they'll stay in the regions and become one of those ripples.
I would say, just to add to that, I wanted this book. Some years ago, I was teaching this interdisciplinary sort of intro level class on sort of health equality with a few other colleagues, and mostly to pre-med students. And my section of the course was like the political economy section, and they hated it. I mean, it was just it's a big leap, no doubt. It is a big leap. And I think the great thing about this book is it takes seriously kind of the stock of what students might know upfront about sort of health outcomes, and then does the connected work. The thing that I can envision using this book for is almost as a model to say, here is the way that these things look in one region. What do they look like where we are in the city of Milwaukee, for example? How would you do that kind of, in a way, the mapping of those ripples of hope, or sort of the assets we have in the community to actually, begin building power around some of these problems? What would that look like if you were going to write that book about this city, or if you were going to begin thinking about how to attack some of the problems that we face here, I think it provides almost like a template that instructors could use to kind of guide their students through an analysis of where they are.
I want to echo to what has been said by Lynn and Philip. I think, just the book makes it quite clear that it's really inappropriate to do place-based research without amplifying the voice of the local residents. Talks about the importance of positionality. What is powerful about the book and Dave's approach is he was acutely aware of the power dynamics and, in terms of making sure that the proceedings of the book go to the Mississippi Delta communities. And I think, that's such an important approach. I also love about how he defined, what the goal of health equity is, which is such an important definition. He says when we are unable to predict a person's health or life expectancy based on their demographic characteristics, their zip code, or their other attributes, I think that's such a powerful definition that could be useful for teaching any health policy or public health related topics.
Wonderful. Thank you so much. As we wrap up, I want to finish with one final question, which is Ripples of Hope is ultimately an optimistic book. And the first message of the book, and it's something that's carried through, is the idea that health equity is possible. As we wrap up here, it'd be helpful to walk away with some lessons you would take towards how we can produce that more equitable future. So as you think through David's book and the lessons it provides, what kind of lessons should we be walking away with today about how we produce that more equitable health future?
I'll just jump in and say, as every one of the examples that he demonstrates, it was people, collaborating, working together, engaging with each other to solve problems. And we can think about some of those examples as being very, kind of small or community specific, but it demonstrates the larger value. And I think that's what it takes. And it's that kind of collaboration across difference that's going to make the biggest difference.
And I see that Dr. Galea has joined us, and that we're almost at time. So I'm going to be wrapping up our discussion now. So I want to thank you all for joining us today, and I want to thank you to all of our esteemed panelists. It was an honor to moderate this discussion and an honor to honor David's legacy in this way. I'll pass it back to Dean Galea.
Thank you, Professor Callahan. Thank you, Tim. And thank you to Jamila, Bizu, John, Philip, and Lynn. Thank you to Deborah for being along with us in this journey. I think the best scholarship done by the best scholars creates opportunity for further scholarship, further discussions, for asking more questions, and for building on the work that anyone does. I think David was among the best scholars. I think his work is an example of the best scholarship, and I think this public health conversation attests to that. It's really, it was a privilege and an honor to be David's colleague, and it's a privilege and an honor to honor his work in this way. So I want to thank you all for allowing us to do that, and I want to thank our audience for participating in this, and I want to thank Deborah and David's family for allowing us to so celebrate David. This afternoon at our school, we're hosting a reception in honor of the book. Anybody who's in the audience who would like to come join us at our school, who is local, you are welcome to join us at 5 o'clock today. Once again, to everybody for giving us the opportunity to reflect on and to celebrate this work. Thank you. Everybody, thank you for the work you do. I hope everybody has a good afternoon and a good evening. Take good care.